This is Generation Health. Every week we bring you news, cutting-edge research, and time-tested best practices for living a long, healthy life. With the tools and information available today, this generation has the potential to be the healthiest in human history. Following in the footsteps of our founder, Joe DiMatteo, we are the second generation of a family dedicated to helping you live better and longer. Across from me, Mr. Joey DiMatteo, registered pharmacist, board-certified clinical nutritionist. How are you?
Very good. How are you, sir?
I'm phenomenal. This is fantastic. And to my right is Dante DiMatteo, also a registered pharmacist and a certified strength and conditioning specialist. How you feeling?
Feeling good.
Yeah?
Yes,
strong?
sir.
Feeling
Ready
strong?
to roll.
Strong.
Awesome. Very cool. Well, listen, today you guys responded when we asked for questions, and I really appreciate that. We have so many of them that's all we're going to do in this episode is answer your questions. We have a bunch, and we're going to see how many of these we can plow through before we get to a ridiculous length of an episode. So I'm really excited about that. But first, I have to ask the unrelated question of the day. Have you ever read a book that changed your life? And you may not say the Bible.
I'm going to be kind of lame on this one. I cannot pin anything.
Really?
Yeah.
You haven't-
And to be quite honest, it's because it's just the way that things have evolved for me.
Yeah.
I typically am trading, if I am reading, I'm trading it for TV time.
Sure.
Just the time of the day that I end up doing it. And then so when I do read, I end up reading fiction.
Yeah, well.
And instead of none of that, no, I cannot think of one that's literally changed my life. Just swapping it out for a TV series or something. Pretty lame.
Not even high school?
It actually motivates. No, it motivates me to read some nonfiction and that
I'll get you a list.
Yeah, I'm sure you can, because I want to hear your answer.
Okay.
But yeah, I'm going to be pretty lame on this one. Nah, I need some advice.
Fair enough. All right. Well, that was uneventful.
I know. I'm very
Save us,
sorry.
Dante.
Oh man. I would say I know there's something that I'm just not
All right. Well, when
thinking of, but the easy answer would be the Jordan Peterson books.
yeah,
I would say so.
12 Rules for Life and 12
Yes.
More Rules for Life.
Yes. I mean, it's been a little
gotta
while
read- I
since
have it. I gotta read it.
since I finished those, but I just think it was just such foundational stuff in there. And then it opened the door for me to look into some other things.
Yeah.
And so it wasn't just like it stopped there. It just,
Right.
I don't know. It just kind of encouraged me to go further in different aspects, not just with Jordan Peterson, just
Yeah.
with, all sorts of things. That was a big one.
No, yeah, for sure. That makes sense that's a life-changing moment when it literally alters the direction you're going. You go, okay, there's more out there. I want to read these other things too. For sure. The first one that jumps to mind is a book called The Divine Conspiracy by Dallas Willard. It was the biggest and thickest nonfiction book I'd ever read to that point. It's a great book, just all about scripture and different ways of thinking, and it really shifted things for me. It was really, really cool.
What age did you read that?
24, 25, something
Okay.
like that. I'd always heard my dad talking about it, and I finally was like, all right, I'll give it a shot. That was really good.
Was it?
Yeah. He talks about the Sermon on the Mount, specifically the Beatitudes. That's the part that I will never forget. There were a couple of things. One was early on, he's talking about kind of what is worldview and your perspective, and the analogy he uses is of a fighter pilot and how they have to be careful because they have to trust their instruments, because if they're just trusting their eyes, sometimes they get flipped upside down and they can get disoriented and they think that they are flying right side up.
Wow, I'd never heard of that.
And then the altitude alarm goes off because they're too close to the ground. And so they think they're right side up. So what do? They pull up on the stick, and instead of going up in the air, they nosedive straight into the ground.
I mean, that's...
And so making sure that you are facing the direction you think you're facing and trusting your instruments, that was a really cool analogy that I went, oh, and it tweaked some things. But the other part was the Beatitudes. His take on the Beatitudes was completely different from everything I'd ever heard, and not in a heretical sort of way or anything like that. But, I'd always heard the Sunday school, these are the B attitudes. You want to have these attitudes, and then they kind of, some of them you have to kind of twist and more like, blessed are those who mourn. And you go, well, what that really means is you're sad about the state of the world. And it's like, nah, it's not really what he meant. And the thing that stuck out for me is that he said, these are the part that we always miss in these conversations is that it's Jesus saying you are blessed, and it's not because of your state, it's in spite of your state. That you might be mourning, but because of me, you get to be comforted, you know, and going, oh yeah, it's about Jesus. Oh, duh. That really tweaked things. I don't know. I'm going on and on about it, but that I loved that.
No,
book.
it's a great.
good.
I knew you'd have a great answer. You did not disappoint.
I can give you a list of other books that have been pretty rough. Anything C.S. Lewis, man.
I knew that was a question like aimed at yourself in a way.
Yeah. I'm not gonna lie.
I don't blame you.
I found that question and I
strengths.
went, I got several on this one.
Yeah.
I haven't read many books realistically, but so I look back at the list that I made, and the one that I was thinking of it's called Burn by Herman Poncer.
Okay.
And it talked about we did some videos on it. It was the whole constrained model of energy expenditure.
Yeah.
So the constrained model. And, you know, I guess like at the end of the day, the take home point wasn't something that was like entirely new to me at the time, but that was another thing that just opened the door as far as, you know, talking about obesity different and all the conversations that we've been having on the show. It's like a lot of it comes from what I learned from there. And so the constrained model of energy expenditure, he looked at a hunter-gatherer tribe and looked at the difference in their total daily energy expenditure versus like the American population or, you know, the Western world. Yeah. And you would think because they are way more active, they're hunter-gatherers and have to do their physical demands are much greater than ours at this point. You would think that they are expending just like tenfold the amount of energy, right?
Right.
Well, it turned out they actually were expending the same or less than the individuals in the Western world, and they have way less incidence of of obesity and hypertension and all sort of the metabolic diseases. And so it just that's big. I would encourage, even if you don't read it, I would encourage people just to like dig deeper into that one.
I'm gonna dig into that. That sounds fun.
Yeah, it was cool.
I am curious though, because like I pulled it up, and there's a few like quotes in here that it's on Amazon, you know, and it says for practical purposes, this means you basically can't lose weight through exercise because it's saying that our extremely effective metabolic compensation simply shifts calories around so we break even at the end of the day, no matter how much we move.
Yes.
So, I mean, I don't mean to like put you on the spot, but for somebody that is so into exercise and we know all the benefits of it, then does this almost like smack you in the face though? Like, you know what I mean? Like I'm surprised that like, it almost wasn't upsetting. Like how did it really?
Yeah. Thankfully it wasn't like, that's a great question. Thankfully at that point, because this was just a couple years ago now, I think it wasn't like totally new. And I was already starting to hear like in the periphery that you don't burn as many calories as you think, or if you are burning calories, you make up for it elsewhere. It was like, it was out there.
Right.
But I was still like under the impression, or not under the impression, I was still living in such a way that was compensatory in nature. Like if I ate a bunch of crap, I wanted to go work it off doing cardio. Where like you can mitigate maybe some of that, but the amount that you're mitigating, that's what I learned, was the amount that you think you're mitigating by doing some extra work, you pay for it later. You know, it's like through fidgeting, through NEAT, through non-exercise, you know, thermogenesis, basically.
That's pretty incredible.
It is crazy. Now, in the book, they even looked at, like, what about the ultra marathoners? And what about the Tour de France people who they burn like 10,000 calories in a day? Yeah. There's still a level of compensation, even at those high expenditures. Granted, like, they're still in a different category. Right. But for us, you might be able to lose some weight in the short term, but no matter what you do, in some sense, your appetite goes up, you stop fidgeting as much. There's these little things that you don't really think of. And so again, that's why the whole overweight obesity conversation is so interesting, because it totally changes how you have that conversation.
Yeah, because
you can't just go work it off. The exercise is beneficial for all of the other reasons versus purely just the energy out, energy in equation.
Weight and
it's way more. Exercise helps you control your appetite. It helps, ultimately the best way to control your metabolic rate is to put on lean muscle. How do you put on lean muscle? You have to exercise. So there's all these sort of like downstream ways to do it. But the days of telling people you need to just walk on the Stairmaster for 45 minutes because you got to burn those extra calories, unless you're like just cutting for a bodybuilding show, it's not going to really do a lot for you in the long term because you have this you have a evolutionary protective mechanism at play that's going to make you hungrier. That's going to make you irritable when you're a little bit low in calories. You're going to sleep a little more, or whatever. It's just like these crazy, crazy little things.
So that's why in the extremes, like celebrities actors that lose, Christian Bale loses a gazillion pounds to do a movie and be rail thin. And they talk about how do you do it? And he said, I don't eat.
Yeah.
He would eat an apple a day. Literally, that was all he would eat in a day, and drink some water, and that's the extent of it. So he literally had to starve himself because his body would compensate, and you can reduce your calories to whatever, 700-800 a day, and his body would just go, okay, well, we'll just slow down to that point. So he'd lose weight, but not past a certain point. So if he wanted to get to an unhealthy thing, that's fascinating.
Yeah, it would require a lot more appetite suppressants, and to do what he did would be very tough.
It's the extreme thing you're talking about, like with the ultra marathoner, or if you're needing to present an Auschwitz victim on film. Those are the extremes, but for most, and I can see how that would flip things around for you.
Honestly, I need to read it again. It's really good. Poncer is always, he's on Twitter and he's always like talking about interesting stuff. And his whole thing is he's not even like he's not like a strength conditioning coach or nutritionist kind of a guy. He's like a anthropologist, I believe. And so all he was doing is just looking at things from an evolutionary historical perspective, and how does this relate to what we're experiencing now? And so it was just a super fresh perspective on that. It's like you wish it would just work the other way, but it really doesn't.
You should read more books, Joey. You could be part of this conversation.
That's exactly what I'm thinking right now.
All right. Well, digging into it, this is an email from Mark. All these questions were emailed to us, questions@askjoedimatteo.com. That is how you can get your question in here. So this one's from Mark. He said, my wife and mother-in-law told me that I should take vitamin B complex. The problem is that when I do take vitamin B, my sleep is not so restful. My sleep is not deep, and I wake up far too easily. I also can't take more than 1 capsule of daily essentials a day due to that sleeping issue. So my question, is this normal? My wife and mother-in-law both have sleeping issues, and I wonder if the B complex may be playing a part in their issue relating to sleep as well. Thank you, Mark.
Yeah, so first of all, the Daily Essentials link to vitamin B complex. The Daily Essentials has a lot of B vitamins. Essentially, to use the same word, but you do not need to take a B complex if you're taking Daily Essentials. That's the one thing that we can say. If you're taking Daily Essentials, am I getting enough D? Am I getting enough C? All those things we would say no if you want therapeutic amounts of those nutrients anyway.
Right.
Not just covering bases, except for the Bs. So that would be number one. If he was doubling up the B complex in Daily Essentials, potentially. But overall, we know that in general, this can be the case. Vitamin B, the family of them, which is what they mean by B complex, as well as Daily Essentials. The Bs are involved in energy production.
Sure.
Both in the sense of they're coenzymes or vitamins that are converting fats and protein into energy. But they're also involved, especially B6, in neurotransmitter production. If I had to pick which one of those is more likely to be causing this, it would be the neurotransmitter end, that potentially these can be a little stimulating. Now, with all that said, to me, the key thing is still the timing of this.
Okay.
If he is saying that he's taking 1 Daily Essential in the morning and can't sleep, then I'm like, wow, I don't know about
that. Doesn't make sense.
No, because especially because B12 your body does store in the liver. But as a general rule, the B vitamins you are going to pass. Your body's kind of going to use what it can and pass. So if you're talking that length of time that is still, you're producing neurotransmitters at a certain rate, those kind of things, that seems a little tough to me. So if you're taking it at dinner or you're taking it late afternoon or of course at bedtime, does this make sense to me? Yes. If you're taking these in the morning and then saying that that's causing me not to sleep, that would be unusual, is the way I would describe it. So to me, it's about the amount certainly plays a role, but it's way more about the timing of it and when is he taking the either one, the daily essentials and it's because the bees can be stimulating, not in a caffeine way or a stimulant drug way, but just in the general sense of, especially maybe if you're deficient in them, diet, etc. If the neurotransmitter production and then again the conversion of quote fats and proteins into energy and their role there.
Okay, so if you said the daily essentials has enough vitamin B that even if you're looking for a therapeutic dose, there's no reason to take additional vitamin B.
Yes.
The B6 that we sell on its own is if you don't want to take something like the daily essentials, but you need some B, that's there.
Yes.
So if he's taking daily essentials, stop taking the extra vitamin B.
Yes. And the only caveats would be if you're looking for that, you've read a study or whatever, you're looking for a mega dose of B6. Okay. You're looking for, you're deficient in B12. You're testing low. Our 500 mics, per 4, I believe, is not going to move the needle for you if your B12 is low. So I maybe would, not
slight caveat.
Yeah, slight caveats, but in general, you're not looking for anything out of the norm or unusual, or you're not diagnosed with anything deficiency. Yes, you do not need to take coenzyme B, be doubling up.
Okay, so that's part number 1. Part number 2 was if he's taking it at night, stop that, take it in the morning, and see if that changes things.
Yeah, not even late afternoons I can buy, evenings definitely can buy. The morning, I don't know.
Okay.
Yeah.
All right.
I think even what I can kind of see with what Joey's saying is the stimulatory nature of a multivitamin or a B complex. It's probably a little overstated.
Mm-hmm. Right.
Like I would say it would be very unlikely that any of this, even taken late in the day,
even
is
having
what's causing this overstimulation.
Abnormal reaction. Because sometimes that happens. People have weird biochemistry and but you're saying even taking that into account.
Yeah. And it's not I kind of hesitate to say that because it certainly sounds as if I'm minimizing what, his story, but I think this is just another question, another example where we just want to try to maybe, if he was here with us, we would all try to back up a step. We would ask 100 more questions. We dig a little deeper into different nuances of what he's saying.
Yeah, and a lot of times there are people. I mean, if you're out searching for vitamins and you want to take vitamins, you may be having issues. You may already be depressed, but that's why you went and sought out B vitamins. You may already, I don't have a lack of energy, so you go out and seek out B vitamins. So some of that comes into play here too, is the chicken or the egg thing. Maybe he already had some sleeping issues, but he doesn't really notice them. But when I take this vitamin, there's a lot of psychological things that can come into play about who's taking these vitamins and why. That can that can come into play, I think too.
Yeah, and there's a small scale paper that showed that some of the subjects were that they experienced a little more insomnia, I believed.
Okay.
With a melatonin product combined with different B vitamins. And I want to go back and look at this a little more closely. But then there are other studies and there are other products that have certain B vitamins in their sleep products that are supposedly helping somebody reduce these symptoms of insomnia, including ours. So this is a tough one. It's not to totally discount what he's experiencing. And then there's even another little spin I want to put on this answer. So let's just say we didn't know that he was taking our daily essentials, our B vitamin. This was somebody who came in off the street and said, I just started taking this multivitamin. I got it at the local vitamin shop. Right. And all of a sudden I can't sleep and I'm having these issues. Like, do you think there's any relation there? My head sort of jumps to, just given the nature of the supplement industry, is potential contamination. It's a multivitamin.
Purposeful, too.
Yeah, it's a multivitamin. It's a B vitamin. You're advertising energy production. So who's to say 50 milligrams, 25 milligrams of caffeine or something isn't in there as a, intentional form of contamination.
Wow.
So it would be very unlikely that our specific product would be contaminated.
Right, we test for that.
It's not impossible. You know what I mean? There's recalls and things that happen all the time. But given the laundry list of our products, the complete catalog of our products, they're all third-party tested. The labs are under, certified good manufacturing processes, CGMP, and in this case, that would be a question that I would ask him and just say, hey, where did you get this? What's this product?
Yeah.
There's a chance of contamination. Is it likely? I don't know. Maybe it's worth considering and just worth thinking about if we flip this around and one of his friends asks him that question and he can at least say, hey, where did you get this? Did you get this from China? Like from some websites you saw? You know what I mean? So
yeah, like Dante said, though, especially with that link to energy.
Yes.
The B's and energy, because people will ask that too, or a lot of times it's just straight B12.
Mm-hmm.
Well, I hear B12. I see your B12. I'm going to take that. I've been fatigued. I'm going to start taking your B12 because that gives you energy. It really only gives you energy if you're truly deficient. And it could be really because it's not B12 itself. It's linked to, I don't want to go into this too deep, but it's linked to anemia and your body's ability to carry oxygen. That's really, when that's the link of B12 to that. So if you're not deficient and you're not anemic, just taking B12 and thinking that's going to give you an energy boost is unfortunately flawed. The whole family of them I can buy a little more, again, because of the link to neurotransmitters and energy production and conversion, etc. So that I can buy. But B12, you've got to be deficient, unfortunately, and then you're going from a negative baseline to a normal baseline. You're not going, to a high energy state.
Okay. So, and then for the ladies, because he was asking about his wife and his mother-in-law, based on what you guys said, I'm assuming that the answer is no. That's probably not the case. That if they're having trouble sleeping, it's probably something from a laundry list of other things, whether it's hormones or it's exercise or lack thereof, or it's stress or anxiety or whatever.
For sure.
It could be any of a number of other things, but it's probably not from the multivitamin or the B's.
If I had to bet, I would say it's unlikely, but in worth a multitude of follow-up questions.
Definitely.
And then, and then even the last thing, there was one part of his question that jumped out, and it was the part that was, my sleep isn't as deep. I find myself waking up. That to me screams, take the Stop Bang questionnaire, the validated questionnaire for sleep apnea.
Yep.
It's 4 questions, plus it just takes into account your BMI, age, gender, neck circumference, that kind of stuff.
Yeah.
Answer the questions. It just asks if you have excessive daytime sleepiness, snoring, all those sorts of things. Males are at a little bit of an increased risk for sleep apnea. It's so common that it's not going to hurt him to do the screening questionnaire. If he notices anything from it, it at least puts him one step closer to bringing it up to his doctor or whatever.
Cool. Very cool. All right. Email in from Dawn. She said, I was diagnosed with breast cancer and will be getting a lumpectomy next week. My question is, what hormone blocker is safest to take when I already have osteoporosis? What foods are good and bad to stop recurrence? And before you answer this, I just want to say, we did answer this directly as soon as it came in because of the time-sensitive nature of it. So we didn't leave somebody hanging, but let's pretend we hadn't. Let's help Dawn.
Yeah, I wish I had a better answer to this all the way around.
Yeah.
When you're dealing with something this serious and you're kind of in a more alternative health, for lack of a better term, realm, and you want to say, hey, I know drugs, I know supplements, we can navigate. But me personally, I'm going to end up being a little more by the book, at least on the drug questions. Yeah. And I'll go into a few reasons why. In a perfect world, like if you were just looking up, hormone blockers and osteoporosis, you may come upon a drug called Avista, and that's where my mind went too. I was like, what about Avista? Are there studies out there that would show know that Evista could be good in this case because it's a very unique drug. It has a mechanism of on certain estrogen receptors, it's a blocker or an antagonist. On other estrogen receptors, it's an agonist. So the agonist part would be bad in breast cancer because 80% of breast cancers are estrogen receptor positive, which means that estrogen feeds them. That's again 80%, and she's discussing a hormone blocker. That means it came from her doctor. That means she's part of that 80%. That's not too hard to deduce there. So I thought, what about Evista for those reasons? Because if it's a agonist or stimulating in areas of the body relating to bone health, that's going to improve because estrogen helps to improve bone health.
Right.
And then it can be a blocker at the breast tissue, do what the drug would like to do, and then maybe she could not go on a bisphosphonate, etc. Because I'm assuming that if she's sending us emails and following us, that and my dad, she was probably along the lines of not wanting to maybe go on that.
Yeah.
So unfortunately, studies show that it is not very effective or effective enough when cancer has already occurred. So it is approved to help prevent breast cancer. So if this was way earlier in the game and there was where we wish we were, that there was no breast cancer and maybe just some osteopenia or et cetera, and it was early on, then Evista could be a good option, kind of looking down the line. But at this point, once the cancer has occurred, especially invasive breast cancer, it is just not effective enough. And you're at this point, you're dealing with something so serious, it's not where I would play around. So I would stick with a pretty basic recommendation. It's probably going to be similar to her doctors of Arimidex or an Anastrozole or Femara or Letrozole. Okay. That is what I would recommend, again, given the situation. So that is going to make, she already has osteoporosis. Maybe she's already on a bisphosphonate or a drug. That would be likely. But at this point, because the hormone blocker, the estrogen blocker, is going to exacerbate osteoporosis, that it's going to be recommended. Again, I wish I had a better answer, but even if that helps to ease her mind a little bit, maybe in terms of why can't she do an Evista, or why does she really have to go on this hormone blocker, or now the doctor's recommending a drug that she's been able to kind of stave off, why is that happening? Maybe if just even from a different perspective can help explain why.
Right, from people who are into the natural thing, no, really, this is not a natural thing sort of situation.
Yeah, that's unfortunately a good way. Not there are other things you can't do all the way around, but the core question.
Yeah. Okay. Mm-hmm. What are there foods that are better than others?
There's as much as you'd want to say there's a special diet for her to follow. There's really not a whole lot else besides what we're typically recommending.
Yeah.
Limiting saturated fat to an extent. Definitely in this case, limiting processed foods, ultra processed foods, processed meats, nitrates and such, which almost lend themselves to cancers.
Right.
So definitely something you would want to try and watch. As far as any certain macronutrient breakdown or this magic antioxidant containing food, not a whole lot. May not be a bad idea to consider mixing in plant-based protein options. In some sense, eating tons of red meat, probably not the best idea in this case.
Right.
But overall, those are all things that I try to do myself, that we talk about, that unfortunately there's just sort of no magic bullet there. I hope that kind of...
So whole live foods, eating the rainbow, as your dad always said, lots of plants, lots of fruits and vegetables. And when you're eating protein, stick to things like chicken or fish or a plant-based source. But I mean, even that is not, if you're eating organic meat, that's probably going to help, right? Theoretically.
Yeah. I would say that the meats that are super high in saturated fat, which are generally the red meats.
Yeah.
Try to mix it up. There's a whole argument outside of this right now going on with the plant-based foods and the meat consumption and carnivore diet and Liver King. It's like funny how all of this ties together, but you are better off being as varied in your diet as possible
and avoiding ultra processed, which is always the right answer. But especially in this situation, that's the best we're going to have.
Definitely. And the tangential thing that always goes with diet, looking at resistance training in her case, especially with osteoporosis.
And resistance training is picking up heavy things. It's weightlifting, right?
Definitely. And there's a different entry point with that for everybody. So if she's not doing tons of resistance training at this point, it's probably not best for her to jump into something that she's not comfortable handling.
Right.
But the key with osteoporosis, osteopenia, preventing it from occurring, preventing it from progressing, improving its current status and all that stuff. Definitely want to be trying to move relatively heavy weight.
It's all relative.
Yes.
Yeah.
But and
That's
so
key.
whether she starts
Mechanical
with,
loading, like
she starts with bands or something like that, but moving heavier things around than what she's currently doing.
Yeah, it helps. It basically tells the body needs to make the bone stronger. So you're doing whatever you can to
Makes sense.
to get your body working in that regard. You know,
Okay.
on top of all the other benefits of exercise, and
All right. Any other huge lifestyle changes we want to address?
There's a lot of
there?
stuff out there.
Sure.
I looked at even like testosterone replacement therapy that can help with osteoporosis, and there's controversy over whether it can lower breast cancer recurrence, even though that would be kind of the opposite because you're blocking aromatase, which converts testosterone to estrogen. So there's a lot of things out there, and I could see Dawn following up email with this study or that study. My problem was when looking at a lot of those things, I kept seeing conflicting.
Sure.
Or the study that was positive on it was very small, those kind of things. So there's going to be a lot of stuff out there if she starts Googling, things like that and natural breast cancer remedy, but it's just so serious to me that I don't think it's a route I would.
The risks are high.
Yeah.
All right. Well, Sandra asks, are there any supplements that can help with seizures?
Theoretically, yes.
No details. We don't know age. We don't
Yeah.
know what's causing the seizures, but...
So theoretically, yes, CBD can help. The issue with it is, and the reason why we know this for sure is Epidiolex is a medication that's just pure cannabidiol, and it's extremely expensive. It is high quality CBD, and we did carry it. We're actually not allowed to have it online for legal reasons, but we did carry a very high quality one as well.
Yep.
We do have it in the store, but for legal reasons, we can't put it online. But either way, the problem that runs in on top of the seriousness, again, same theme of the seriousness of seizures. And, yes, you may not want to take this drug that you're on or this drug you've been recommended. We certainly understand that. This Epidiolex or CBD is usually more of an add-on to medications than a standalone.
Okay.
A. And then B, you need, even from ours, you need mega doses of ours. So you end up going through like a bottle a day of our most concentrated one to match the dose of Epidiolex. So you may think, and it still comes out to be less expensive. I did the math on it. But Epidiolex at the same dose that you would do for a 160-pound person is like $7,000. So it's a ton, but ours would still be $5,000. So it's still, both of them are extremely cost prohibitive unless insurance is covering, which only has a shot for the Epidiolex.
Yeah, insurance isn't going to cover ours, though.
So that's more of a theoretical answer. Again, aiming at somebody that's probably Googling CBD and Googling natural, you know what I mean?
Yep.
So that's kind of where my answer is pointed to. The issues with it would, again, be the dosing. So theoretically, yes. But if you just jump in, CBD helps with seizures, I'm going to stop taking my lamotrigine and jump on, the half an ml of our CBD, and I'm going to.
That's not going to cut it.
No.
Okay. All right. Jenny asks, is there a way to test for PMDD?
Good question. There's no blood test. There's no saliva test. There's no.
You can't pee on a stick and find out.
Unfortunately, not. Granted, there are hormonal changes that are occurring throughout the course of a woman's cycle. The way that you would ultimately see this diagnosed is in the symptomatology. So you have PMS-like symptoms, the mood changes, the breast tenderness, bloating, all those sorts of things. But then typically what you'll see during the week leading into menstruation or your period is when your symptoms start, and then they typically resolve within that short time frame after the period. So the way to diagnose, the way to test for it, so to speak, would just to be, confirming based upon, some sort of diary, some sort of notes that you've taken on when your symptoms are worse, when they start, when they end, what your symptoms are like, the severity,
right?
How many of those, and that's ultimately what will help, that your clinician guide the
Okay,
treatment.
so it's not there's not a quick check that you can do and get a definite yes or no. It's the dysphoric disorder, so it's based on how long and how severe.
Yeah, in an indirect way, yes, testing for levels of your hormones, it does require a commitment. Because again, you've got to pay for the testing and pay for consultations, and commit to testing at different points. So there's an indirect way that you can test, but the direct answer is no. It's not gonna prove that your PMDD is there. But if there are some things that you want to do to help change your cycle and see if that gives you some relief, then you can test for those hormones and deal with it that way indirectly, and dealing with one of the symptoms.
Okay. All right. Pat from Boston says, I'd like to come off cholesterol medication. What can I use in its place? I have listened to your program for many years and use your products. I miss your dad. Sad face. Yep, we all do. I'd like to come off of cholesterol medication. What can I use in its place?
Yeah, I mean, again, the most direct answer, can we just do red yeast rice and bergamot? Potentially. There's a lot of questions that would need to be answered in between that phase. In the most ideal sense, you catch somebody like at the beginning. Their doctor's like iffy on it. The new school way of putting somebody on a cholesterol med was maybe a lot different than 20 years ago.
Right.
Or, when my dad was first doing consults and, just swapping out Lipitor for red yeast rice and things like that. They, like Dante's explained in other shows, they're getting a score based on your family history. Are you a smoker or not? Blood sugar, are you diabetic or not? There's so many things, high blood pressure. All these things are going into this score that, not necessarily just your cholesterol number.
Right.
So if she kind of got diagnosed, 15 years ago, her overall score is fine, maybe 10 years ago, and her number was just a little high, maybe a little more of an old school approach. Your LDL is a little high. We throw you on this 10 milligrams of Lipitor. Yeah, then I think we could do that. But if she's, got a family history and she's very overweight and all these things, and it's been 15 or 20 years and her score is pretty high, she smoked till she was 40, et cetera, and all those things can come into play. If you start adding those factors in, then it becomes harder. I wish it was as simple as just numbers are a little high, and at times it can be, depending on what your doctor's approach was or where you started. But ideally, you kind of catch somebody right at the beginning. Like my doctor's kind of like, he's nudging me to start a stat, and I kind of shoot him away. I went to see him the next year. He was kind of nudged me again, but he's not really pushing me hard. What can I do to kind of shut him up, so to say?
Right.
Get my number down a little bit, and everything else is okay. Yes, red yeast rice, bergamot, one or both, depending on where you are, is a great option, And then there's other people that just aren't going to take the statin. They've read this, they believe this, they're not taking it, and that's the end. They're either doing nothing or they're going to do something and at least get that number down. And in that case, if that's the decision you've made, then at that point, it's better than doing nothing.
Yeah. So red yeast rice, bergamot, and then beyond that, exercise, weight loss, blood sugar control.
Absolutely. Yeah, making sure all those things, being in the proper way, it's going to help your blood sugar and your diabetic risk. That's going to affect that score. It's going to affect your blood pressure. That's going to affect the score. Things you can't do anything about are obviously family history.
Right. And stop smoking.
Yes.
For the love of all that is good and holy, please stop smoking right now.
Yeah.
It's not going to do you well in the future. Okay. Cool. Brilliant. We're busting through a bunch of these. Chris asks, what can I use on skin yeast in my groin area?
Yeah.
Who wants that?
No, I know. That's a tough one. Fortunately, it can be managed over the counter.
Okay.
There's a whole list of different antifungals that you can use. The technical names for all of those that come to mind would be terbinafine, clotrimazole, econazole, ketoconazole, miconazole.
Yeah.
Some of which are prescription in certain strengths, others that you can get in a spray, a powder, and a cream. Mm-hmm. The key is first, just in addition to just understanding what the treatments are, which again are the antifungals, how does this occur? Why does this occur? There's obviously just some moisture that tends to accumulate, and then the friction in the area can cause some irritation.
Yep.
And it's just sort of an insidious process that, a lot of people will just for whatever reason are a little more susceptible to, especially if you're exercising a lot, sweat a lot, have tight fitting boxers or, or whatever, all realistic things.
When you say insidious process, you don't mean like secretly evil. What do you mean by insidious?
Yeah, I just mean that it might start as something that felt like, oh, I'm just a little bit itchy in the groin area, nothing to worry about. And then 3 weeks later, you notice the physical, appearance of symptoms.
So it starts small and gets out of hand before you realize it.
Yes.
Got it.
And so if realistically, if you are starting to notice that, in a perfect world, you could use something just like a medicated or non-medicated Gold Bond powder just to prevent the accumulation of moisture in the area that's obviously very susceptible to that accumulation.
Got it.
But then looking again at those antifungals, he would be able to try something like any one of those in a cream form. You could use them in a powder form. You could use them in a spray, and he might just have to play around with those different options or use a combination of those. I find that the powders are a good option.
Some nice talc-free ones too.
Especially since a cream or a lotion isn't going to dry right away, and it's not super comfortable. So maybe if you're just laying around the house, you could use a cream to start, but when you're going to work, try to apply the powder, try to use the spray. It dries quicker.
Cool.
And then you try to give it some time. And I don't know, Joey, does that
Definitely. Yeah. I think the powder makes the most sense. And I think that you nailed it. Yeah.
He didn't ask this, but I'm going to ask because I'm ignorant on these things. Is this the same sort of, is this contagious? Could he spread this to his wife?
Good question.
I believe you can theoretically, but again, if she doesn't have the same breeding ground for it in the area.
Oh, that makes sense.
Yeah, because you do see athletes' foot spread like in locker rooms.
Right.
Yeah.
And it's the same type of infection. It's on this area of the body, moisture, etc.
Everybody's got the same strain, and it's
all
just
the
going
guys
around.
in there. Yeah, all the athletes have the moist feet. They're all throwing their socks on right after their shower, that kind of thing. So is it as likely in a home setting? With one person that's maybe a little more dry in the area, it's possible, but unlikely.
Okay. All right. Deb wants to know, what can I use to chelate any heavy metal presence in my system? Maybe she's been having some dark chocolate. Needs to take care of that.
So it's a very controversial topic in terms of pulling. And you start talking about pulling out the metals.
Is that what chelate means?
Yes.
Okay.
Essentially, it says like binding them up. So again, there are people that, alternative practitioners that truly believe in it. For a while, my dad was doing it. The reason why we don't do it anymore is a little more legal. Joyce, as a nurse practitioner, is not allowed to write for DMSA. That's the drug that we had used.
Okay.
There are guidelines out there orally. It's a little safer than, it can be a little riskier using it IV. So again, this is a controversial one, but it can pull out other minerals, which, can cause issues with your kidneys and just general health. If you start pulling out magnesium, calcium, zinc.
Yeah, those are important.
Yeah. So that's the one thing that you could worry about. So you'd want to do a test that you can trust, like a hair test or something, to make sure that you need this, not just maybe looking up a few symptoms and saying, there's not any other information here. Why is she asking about this?
Right.
Would be one of my first question for her. So we're not as on the ground with it as we used to be in terms of seeing results and seeing if there are any issues with it. Again, we used to do it a lot, and it's been years since we've done it. So we do, as a compounding pharmacy, fill it for a few patients from other prescribers. But again, we're not following up with them. We're not seeing it on the ground like we used to. So I would, again, A, why are you asking this question? And then B, get a test, to see if it's really true, or if you're just kind of tying in some symptoms that you're reading about.
Sure.
And then C, at that point, if it's what you want to do and something you believe in, which I totally understand, you could find a practitioner in your area that can do that for you.
And if she just wants to avoid heavy metals, what is the base steps there?
Yeah, I mean, at its foundational level, outside of things that you would be exposed to in your environment, God forbid, an older home of some kind. I mean, you don't really see that much anymore, but where you work, is there metal exposure, things like that. That would be first and foremost, but also in the food that you eat, as much as you can, organic is going to be a little less likely to have a heavy metal burden, because again, you can end up having, metals in all kinds of food. So I think it's going to come down to A, your environment, number one, if there's no issues there. And then B, the more you can eat organic and then know the source of your food, small farm type stuff over, big box name, Walmart brand stuff. There's nothing wrong with that. I know we all got to save buck here and there. I totally
Yeah.
get that.
Yep.
But maybe when it comes to your produce, that may be the place to splurge a little bit, and
Fair
especially
enough.
if that's a concern of yours.
I know Joyce always talks about the Dirty Dozen and the Clean 15, so pay attention to that stuff
Yeah.
too. All right.
Yeah.
Mary Lynn says, please talk about anything that can be done relating to psoriasis.
Yeah, I firstly, I wish there was more that you could do. I mean, there's a multitude of treatment options, but as far as what can be done, nutritionally, over the counter, supplement wise, it is a bit limited. So depending on which form of psoriasis that she has, there's a few different ways that, dermatologists break that up, which is, I would say, beyond the scope of this question. But depending on severity, whether it's localized or generalized,
Sure.
on the body,
Yep.
will guide treatment. You're most likely going to have to use topical steroids of some form, whether a spray, a foam, a gel, a cream, similar to the antifungals. There's different forms that might lend themselves to, a better outcome for a given individual. So steroids, they're going to potentially use some of the vitamin D analogs, which would be calcipotriene, which is a big one. We see that a lot in the pharmacy. So oftentimes they'll use that in combination or alone, depending on how the steroid worked, with or without it.
Right.
Topical retinoids, Tazorac is a big one that's used. Another topical. So as you can see, the theme is you want to try as many topical agents as you can first before jumping to oral corticosteroids, or now they're using biologic medications to treat different forms of psoriasis. So like Humira and that whole class of meds, like the disease modifying agents. In addition to some of the topicals I mentioned, you can get some salicylic acid over the counter to use as well. There's prescription strengths. Coal tar is another big one. We compound that for a handful of people that still seemingly works very well. It seems in recent years, light therapy is very promising. But
Ultraviolet light.
yes.
Yeah,
So,
so sun. mhm.
Oh,
yeah.
okay.
So sunlight, I think you still want to be careful because that can quickly flip the other way. And
To a burn or something like that.
yeah. So you have to be careful there. But admittedly, light therapy in general is just a little bit beyond my expertise. But it seems like it shows some promise. People are using it in addition to the steroids, in addition to the vitamin D analogs. So I would say it's worth talking to your doctor about that. We talked a little bit about the injectable medications like the Humira, the Enbrel, those big ones.
Yeah.
Those are typically limited for or reserved for, more extreme cases. Methotrexate's another big one. And then alternatively, beyond like a CeraVe product or something containing some aloe vera, there's not a whole lot you can do. There was a lot of stock put into omega-3 fatty acid use, which is not a bad idea to try, but I think that's controversial at best as far as how well it can work. But I think if she's tried everything and she hasn't done omegas, then there's obviously some benefits there, especially if she's not eating a diet rich in omega-3s. She could definitely do that. So
Okay.
all in addition to if she's already doing the corticosteroids and the the other creams.
But definitely talk to your doctor about that one.
Yes. And unfortunately, it's like we don't even really know what causes it either.
Yeah.
There's an autoimmune component, another one of those very nebulously
Complex.
defined.
Yeah.
Yes. Yeah.
Wow. All right. We still have plenty more. If you have questions, again, email us questions@askjoedimatteo.com, AskJoedimatteo.com, and we will try to get to them as soon as possible. Wrapping out here, I just have to know, how often do you know you are right but let it go to avoid an argument?
No, I'm right. That's the complicating one, I think. No, I'm right, or feel I'm right. I would say that I do it with.
Yeah, I know where you're going.
Yeah, I was going to say it with my wife.
Yeah.
But we don't really, fortunately, argue a whole lot.
Yeah.
But, there are times where I just know, and I get in these moods too, where you're you're just not in a great headspace.
Yeah.
Do you know what I mean? And you maybe just are gonna snap back, and no matter what the answer is, you're just upset, you're tired, whatever. And and my wife is very rarely does that happen. Does she do that? But I would say that would be the times where I can tell that she's, you know, got the 3 little kids and she's blown out, and I know she works so hard from the time she wakes up to the time she goes to bed that I know that if that's, you know, she's fading a little bit, which is unlike her. If she is, then I know I need to back off regardless of what the issue is.
Yeah.
So
yeah.
Did I say that delicately
That
enough?
I get it. It's going to sound a lot like my answer too.
No,
How often do you know you're right but don't say anything?
admittedly, I struggle with this one.
I was gonna say
I'm actively working through this. It's especially tough because Nicole, my wife, as of just less than a month ago, we both go into arguments kind of like guns a-blazing.
Yeah.
So it feels like looking back, it's almost as if we were fighting for wins and losses or something, you know? So
That's natural.
yeah, man. So I'm open. I'm working on it.
Yeah.
I'm definitely working on it, but I think Nicole could vouch for me that I'm improving slightly.
You got a lifetime to figure it out.
Yeah.
I have teenagers.
So I would say that
you usually fight the fight.
How often do you know you're right? I feel like I'm always right.
Right. Well, of course. And if you thought you were wrong, you would change your position and then you would be right.
Oh,
right.
man.
Yeah.
That's, I have teenagers. And so I do this daily when they are saying something, shooting their mouth off about something, complaining about something, and I just bite my tongue because it's not worth the fight.
But that's got to be tough as a father because you also feel like you're there to guide them and to point them, and you're very learned in the different things you read and very well read. There's got to be times where it's got to be tough, right?
Yes is the answer. Yes, it's
Yeah.
very hard. But my kids don't want me to run their lives for them. They want to make their own mistakes and learn themselves, and that's fair, and they need to. But boy, it would be just so much easier if they just do what I told them. But no, the older they get, the more I don't know if I've learned. I'm trying to learn to take my hands off and go, okay, if you want any advice, I'm over here, but I'm going to keep my mouth shut for now. And with my wife, for sure. This is the thing that I learned a long time ago. Somebody said to me, do you want to be right or do you want to be happy?
Yeah.
Because you can't be both.
Yeah.
You're only going to be one of those two things. And so I have learned, especially on the things that don't matter,
Right.
I don't have to be right.
That's the key, the things that don't matter.
Yeah.
Yeah.
Oh, it's a big one.
Yeah, wow.
Oh, well, all of the products that we talked about today are available on our website. That is askjoedimatteo.com. Again, that's askjoedimatteo.com. That is also where you can sign up for a mailing list to keep up to date on what is on sale and when new things come out, new episodes, new blog posts, all that stuff. You can find past episodes of this show as well as the classic show that started all of this, Ask Joe DiMatteo, all available there on the website. If you have a question, like all of these, email us, questions@askjoedimatteo.com. All of our show notes, anything we mentioned, will be available on the website and down in the comments. Big thanks today to Josiah Schweinberg, who handles our cameras, Michael Deppish, who is our editor, Joyce Gibb, our nurse practitioner. She got some shout-outs today. Mm-hmm. She handles private consults. Diane Silverman manages our product. We've got Terry in scheduling, Cecilia in distribution. That's Joey DiMatteo. That's Dante DiMatteo. I am Tyler Andrews, and now that is it from us. But the question is, what are you going to do with what you have heard today? Are you going to take action, or are you just going to hang out and listen? I hope you'll take action. Be part of this generation. Generation Health.